I'm going to be talking to you about the mental disorder anorexia nervosa. So the general overview of the mental disorder, it's pretty much an intense fear of eating. So they severely limit their portions, or rather not eat at all, because they think that they are very self-conscious and they think that they'll gain a ton from it. So for not eating, it's very life-threatening for them. So it also affects the body and the mind. So in their eyes, this picture is a very good example for it. When they look in the mirror, they think that they're very overweight, but actually they're pretty much a stick. And they're also in denial that they even have a problem. The main causes of anorexia, there's actually an unknown cause for it, but there's a lot of connected factors that are within biological, psychological, and environmental factors. Biological factors may be including genetics or hormones, hormonal imbalance, other mental disorders connecting to it. Environmental can be pretty much puberty to possible media, like social media. You see all these models that are so tiny and everything, so they think, oh, that's the perfect body, and so they need to be perfect like them. Psychological can be like stress-related or anxiety, and also sexual abuse can be a huge factor as well. Symptoms and side effects. There's a lot of physical and mental side effects to this disorder. The mental symptoms include fear, so they're afraid that they're going to gain weight. They're very secretive, so they try to hide food from people that make them think that they ate it. They have a low self-esteem. That's why the whole, like I said, that's a huge general factor for it. Like I said before, they're in denial that they even have a problem. They also socially withdraw themselves from friends, and that also can cause depression as well. Some of the physical symptoms of anorexia is obviously body weight change. They lose a ton of weight, like I guess the picture shown, like the progress of anorexia can pretty much be devastating. Constipation, like they're not getting the nutrients that they need, so they can't really digest very well. They don't get the nutrients for their skin, so their skin is very brittle and dry. Their hair gets really thin, their nails get very brittle, and they also, their breasts actually shrink too. You can go back, please. Other symptoms would be also like immune deficiency, so they tend to get very sick a lot, and then obviously they also somewhat purge at times after feeling guilty of eating, so they would purge, and that actually can cause tooth decay as well. They also get very bad joint pain too. I also found this really interesting. They actually do have actual food rituals. So when they would eat, they would actually like mess around with their food. And so what they would do is it makes it look like they've eaten, and it kind of fools other people to make them think that they ate, but they actually didn't. General statistics, 50% of the people with anorexia actually are connected with depression. 1 in 10 people actually receive the treatment, which is very, very low, and it's actually the highest mortality rate than any other mental disorder. Some general facts for about women: they are actually more likely to get and have anorexia than men, and especially in adolescence. So, and about 5% of women, they actually suffer from eating disorders. Like I said, adolescence is a very huge age for it, and little kids are actually getting into it more nowadays from all the society and media that's going on. 20% of people actually will prematurely die from the complications with the disorder, so like malnutrition and low body weight and everything like that. Some general facts for men: about 10% of people with anorexia are men, and the majority of them are gay. And what that happens with, a lot of them are actually models too. Like that's a big, big factor. Like it can affect with your job. So like if you're an athlete or anything like that, a model, that's a big factor too, that you could actually get the disorder. that's why we're excited. Thank you for my presentation.